We'll give one more minute and that's it, and then we'll get started, okay?
Carrie, are you okay if I share the screen and just put up the slideshow, make sure it works okay?
Absolutely, go ahead.
Okay.
Okay, perfect. All right, well, I'm going to get started. Good afternoon. My name is Carrie Thompson. I am the project coordinator at the Parent Information Center. I want to thank you all for joining the ADHD Journey webinar today. We have two wonderful speakers joining us, who I'll introduce in a moment. For anyone joining a PIC webinar for the first time, we are a statewide nonprofit organization that provides tools for parents, caregivers, and advocates of children to secure appropriate education and related services. PIC's mission is to improve the health and educational outcomes for children and youth by empowering them, their families, and the professionals who serve them. Today, we have partnered with Child Inspired. Child Inspired Therapies provides pediatric therapy services to children and families in and around Southern Delaware. Child Inspired was inspired by a child, inspired by deeply personal experience and a desire to ease the anxiety and overwhelmed feeling often experienced by children and families during medical and life challenges. Child Inspired is based in Lewis, Delaware. The team of clinicians serve families locally and beyond via home-based outpatient therapy, telehealth services, and community wellness, family education workshops as well. Please welcome Christina and Mandy, co-owners of Child Inspired. Welcome, ladies.
Thank you, Carrie. We are so excited to be here today, joining with PIC in a mission to help families understand something that they might be dealing with. ADHD is something very real, and there's a lot of information out there that needs to be shared. And the more that parents and professionals and educators can understand about ADHD and the journey that a child or family goes through, the better that those children and families will be able to maneuver their journey. We're going to start out with talking about, excuse me, the different types of ADHD. The ADHD for a while before, more recently, we would hear ADHD or ADD, and as of recent, ADHD is now known as ADHD, and ADD was something that was more thought of from an inattentive standpoint, and so you may hear ADD or ADHD, but they're really one and the same now, and depending on the symptoms is how children and adults are diagnosed. Three different types of ADHD. The first one is hyperactive and impulsive type. These are children that you may think of that are, they have a lot of energy. They seem to run, their motor runs and doesn't quite seem to stop. These are some of the things that you might be finding as their symptoms. Things like crashing into things, different things like that. Inattentive type ADHD, these are children that sometimes fall under the radar. Things that you look for with their symptoms are losing things, not being able to follow directions, kind of feeling or looking like they're a little bit spacey in class, things like that. Just having a difficult time attending to when someone's talking to them, giving them instructions, things like that. And then we have children that can be diagnosed as combined type ADHD, where they're showing symptoms in both areas of hyperactive and inattentive. Physicians can use symptoms, they use symptoms described in the DSM-5 to identify ADHD when they are diagnosing. Typically what happens is a child that exhibits 6 of the 9 symptoms in either one of the, in the hyperactive or the inattentive is what they're looking for. They're also looking for these symptoms to be noticeable for at least a 6-month period, and also identified in 2 or more settings, that being maybe like home and school, where they're seeing those symptoms. It's important to say too that for children that are the combined type ADHD, physicians are looking for symptoms in both areas, 6 of the 9 symptoms in both of those areas. So that's really important. Some of the rating scales that you might be hearing about when children are being diagnosed is the Vanderbilt for parents and for teachers, and the Connors parent rating scale are some of the common diagnostic measures that physicians and educators will use.
Okay, so complex ADHD is actually a newer term that actually is reflecting kind of an evolution in our understanding of the condition, its scope, and the common co-occurrence, or sometimes you'll see the term comorbidity referenced in maybe some different information. Sometimes when people see that word, it seems a little bit scary when we think of morbid right there in the middle of it. But basically what that means, that term means that there's more than one condition. So it's not really a scary term. It's used a lot, but co-occurrence kind of captures that. So this complex ADHD is when there's also a psychiatric learning or neurodevelopmental disorder also at play with a child or adult. As many as 80% of adults with ADHD have at least one coexisting condition. And as many as 60% of children with ADHD have an additional condition. So really important to note that oftentimes, that's why I actually love the title of this webinar, this workshop, with it being a journey, because it's not really, sometimes we kind of have to peel back some of the layers of the onion. What's really going on with this child? And it's believed that that common co-occurrence with another condition is due to there being similar neuropsychological dysfunctions going on between conditions. The newest research actually indicates that conditions should be treated simultaneously, not treating one condition first and then the other, but together. So some of those common conditions that do coexist with ADHD is anxiety, tics, oppositional defiant disorder, or what's called ODD, learning disabilities, mood disorders, and substance abuse disorders. I think it's really important for us to just kind of hone in on the fact that anxiety is a very real thing for both children and adults that often do have ADHD. And so, you know, that is a very common condition that is also going on with these children, and it has implications for how this may affect their self-esteem. So more on that when we get to strategies. It may influence, these conditions may influence the presentation and the severity of ADHD and the other condition. And pediatric professional organizations, including the American Academy of Pediatrics, have guidelines that recommend that trained clinicians or specialists assess and develop treatment plans. Okay, so learning disorders, ADHD is actually not considered a learning disorder. But felt like it was important. Sorry, is this still me? So we feel like it was important in this presentation just to kind of talk about how common learning disorders are and how they often, again, with the high probability that there's oftentimes another condition going on, that these are often tied closely together. So many children, approximately 20 to 30% also have what's considered an SLD, so specific learning disorder. They're often under-recognized, underdiagnosed, and undertreated, or what many consider a hidden disability. It's really important to note that a learning disorder is not an intellectual disability. So these children typically have average to above average IQs, but rather it's a gap between their potential and their actual achievement. It's also important to note that a learning disorder is not the result of a visual, hearing, or motor coordination deficit. It's not the result of an emotional disturbance, and it's not the result of an environmental or economic disadvantage, or a lack of opportunity. It's really something that's affecting this child's ability to learn.
One thing we want to talk about is that learning disorders or learning disabilities, as you might often hear them here stated as well, is really an umbrella term for describing a number of other more specific learning disabilities. The federal law under the Individuals with Disabilities Education Act, IDEA, or some people spell it out IDEA. The term learning, a specific learning disability, in the state of Delaware, there are 13 categories when diagnosing a child in the educational system with a learning disability. I'm sorry, with something that is, for not a learning disability is one of those categories. Sorry, I misspoke there. So when a child's being diagnosed for educational reasons. Some of the other things that we're going to be looking at are things like dyscalculia, dysgraphia, dyslexia, nonverbal learning disabilities, oral, written, and language disorders, and specific reading comprehension deficits. I do want to mention that, many of these things when like Christina said, it's hard to kind of tease some of this stuff apart. Sometimes parents on their journey with their children will feel like, okay, we figured out, we have a diagnosis for dyslexia, and we're moving along, and we're doing all the things that we need to do as far as interventions and things like that, but there still feels like there's something else that's missing, or something else is happening there. And it's really important to kind of keep the mindset that there are many different conditions and things that are comorbid with ADHD. And when you think about it, ADHD, with its 3 categories alone, and how individualized that disorder can be and what those symptoms look like, really kind of can throw these things together, and it's hard to tease out. So no 2 children are going to look alike as far as their symptoms and their strategies for learning and for coping. And then when you start to throw in some other things like these other categories of diagnosis, it can be very, very tricky. So it's important to keep an open mind as parents and educators.
So since difficulties with reading, writing, and math are often recognizable problems during the school years, these learning disorders often, if they're detected, and that's a big if they're detected, they would be typically diagnosed during those school years. I think it's important to note that oftentimes individuals with learning disorders do not receive an evaluation until they are in post-secondary education, or oftentimes even in the workforce. And then many don't receive an evaluation at all. And they may never really quite understand why they struggled with their learning, why they may have difficulty with job performance or in relationships with others. It is really important to note, though, that with appropriate support and intervention, and as time goes on and awareness improves, we're getting better and better with this, individuals with learning disorders can have positive, successful outcomes.
Yeah.
So the dyscalculia those are a couple just different, we're not going to spend a lot of time on this. Again, this presentation is on ADHD, but just because this is fairly common with a lot of the children that we see, dyscalculia is a condition that really affects an individual's ability to understand numbers and learn math facts. They have difficulty with math calculation, and really the underlying issue is having difficulty understanding what those numbers represent and then processing that information. Dysgraphia, as an occupational therapist myself, I see a lot of kids with this condition. It affects an individual's handwriting ability, their ability to produce legible and automatic letter writing. So again, it does affect the legibility, but this is kind of more of a condition where it's the ability to like retrieve that letter, and oftentimes numbers too, is very laborious. It takes kids a lot of energy and effort. So it makes that learning in the classroom more difficult. And then dyslexia affects an individual's ability to read and their language-based processing skills, difficulty with accurate and fluent word recognition, how they decode words, their spelling skills. And that's associated with difficulty hearing, identifying and manipulating the sound structure of the spoken word, and then connecting those letters and letter combinations with sounds accurately.
I was going to say,
yeah.
Dyslexia, this is one that's near and dear to my family. We have many members in my family that struggle with dyslexia. And one of the things to consider as an educator myself too, is that, when kids are having trouble with those basic reading skills in, that kindergarten, first, second grade, it's really important to understand the why behind it and to understand how their brain is functioning. A lot of the types of different teaching styles that schools use as far as decoding and the chunking of words and sounds doesn't work for these kiddos. The way that a child with dyslexia learns to read is really by taking sight words, basically. A child that, for instance, sees CAT, as we know as cat, has a very, very difficult time seeing the letters CAT and knowing that that says cat. What ends up happening with these children is that over time, they start to see that word over and over and over again, and they have a picture in their mind. They have to see that combination of letters and know that it represents a cat. They have a picture in their mind of that. So the blending, the decoding, a lot of these things that your child in that first, second grade or kindergarten are coming home and doing are very difficult and not the greatest way, not the best way for children to read who have dyslexia. So that's just my little caveat there on that.
So challenges with executive function. This is definitely a classic marker for children and adults with ADHD. Executive function is the cognitive process that organizes our thoughts and activities, helps us prioritize tasks, helps us manage time efficiently and make decisions. And you'll see that image of the brain there. This prefrontal cortex, the front part of the brain, is where these executive function skills kind of originate. And it's really important that we all recognize that those skills in all of us are not fully developed until mid to late 20s even. So sometimes I've been in different workshops where they've talked about how when you go to rent a car, it's why they don't allow you to rent a car unless you're in your mid 20s. You may be 18 and allowed to drive, but you're not going to rent a car because the rental car industry has figured out that our executive function and our impulse control is actually not fully developed until we're in our mid 20s.
Yes.
So those with ADHD are generally about 30 to 40% behind their peers in this development. And so it's really important, that we're, again, when we go to the support and strategies for these kids and helping them with some of these higher level organizational processes, that we're kind of giving them the supports that they need to be safe as they get older. And also why sometimes when ADHD is left untreated, undiagnosed, unrecognized, that's sometimes where we see that comorbid condition of substance abuse and other things going on, because children that then become teenagers and young adults sometimes are turning to what we would consider a maladaptive coping strategy, something that's really not a healthy coping strategy to try to function.
So let's talk about some of these skills. There are 7 characterized skills that are associated with executive functioning. The first, and remember, these are things that are challenging for children. Some of these can be challenging for children with ADHD. So thinking of it from that angle. Self-awareness. You know, sometimes you might see a child that just has zero self-awareness around others in their space. And we know that children, you know, in general, at certain ages and stages, don't have the skill. However, like Christina just mentioned, kiddos with ADHD are well behind in the percentages of where they need to be by certain ages. So you know, that self-directed attention of what's next if they're doing their homework. And you know, I'm thinking about my own son right now, who's 16 and still struggles with doing homework and then remembering to submit it, because everything is online now, and there's that extra step at the end where I did the assignment, but now I need to upload it to my teacher. And that is something that he still struggles with continually. So that self-awareness of, you know, what's next and the attention to that. Inhibition or self-control. Sometimes, you know, kiddos, especially with the hyperactive and the impulsive type of ADHD, they're often thought of as socially 2 years behind their peers. And this is part of that self-control and being aware of, you know, what's appropriate right now, what's not. And that impulsivity of, this is where we talk about, you know, kiddos doing some dangerous things because they don't have that self-control to stop themselves and say, oh gosh, this is a little bit dangerous. Maybe I should rethink this situation. So as parents, it can be a little scary. And sometimes, you know, parents are looking at their child going, why in the world would they want to do that? Whatever it is. And this is one of the reasons, is that they're lacking in this skill. Verbal working memory. I'm sorry, I missed one here. Nonverbal working memory or visual imagery. You know, kiddos that have a typical neurodevelopment can hear something and think about it visually and see it in their minds. And these kiddos really struggle with this. You know, a lot of times teachers will say, let's visualize this in our head, and they just don't have this skill sometimes. So that can be frustrating for them. What is this teacher talking about? My brain is not doing what she's asking or he's asking me to do right now. Verbal working memory, or that inner dialogue. So just remembering things. You're oftentimes, you know, and this is kind of one of those funny things too, where so you might ask somebody, do you think things out in your head? Do you hear yourself saying something? Like when you're thinking it, do you hear your own brain, like your own voice saying it? Some people do, and some people don't. And that's something that if you don't do it, you would never know unless you ask somebody. And if you do it, you would never know unless you ask someone else. So these are things that are, you know, again, a skill that's lacking in many. Emotional regulation. This is a huge one for kiddos with ADHD. I have 2 sons who are both ADHDers. One is, I should say, he's inattentive, and the other one is combined type. And they are so different when it comes to emotional regulation and adjusting their emotions. The one has a really hard time with it and always has. So we have to do things a little bit differently with him. And that's just something that you kind of have to work through. And again, we have some, you know, some comorbidity with some other things with mood and emotional regulation there. These can be some tough ones. Self-motivation, intrinsic motivation when there is no immediate external consequence. You think about maybe you have one child who can come home from school and get right to work and get homework done and wants to check it off the list and, move along and get through their day. And the other one has zero clue that they have homework, doesn't know what it is, that sort of thing. So these are things that, if there's no immediate consequence for them, then they might not even be aware that there's something that they need to do to self-motivate to do. Planning, problem solving, the ability to take things apart and recombine them mentally in different ways to plan solutions to problems. This is very difficult for many children with ADHD. Multiple step directions is difficult. Thinking about their day and what they need to do, and getting through their day can be very difficult. These kiddos are going to really benefit from things like a schedule, reminders, giving one-step direction versus three-step direction. By the time you've said that third step, they are not listening and they're not able to hold on to that information. So, individuals with ADHD have difficulty with some or even most of these executive functioning skills. So keep that in mind. Okay, educational treatment options. So you're having some concerns in school, and your child, is maybe showing some issues, and what do you do? So my cute little girl over here with her little glasses on in the first column there, you have academic or emotional or social concerns about your child, and what should you do? School's not going well. For any one of those three reasons, what do you do? So the first thing you're going to want to do is you're going to want to contact your child's teacher, and I do encourage you to do this in writing so that you do, have sort of a log of communication back and forth. And you want to include your concerns, and if there is a convenient time for your teachers or several teachers, if your child has one, to meet with you. During that meeting, see if your child, if the teachers are seeing those same concerns in the classroom. And it's important to remember that children, they behave differently between home and school. So you may be bringing concerns to the teacher and they have no idea what you're talking about. And that's okay, because, sometimes kiddos, especially in those younger grades, they're spending a lot of time during the day and energy just keeping it together. So you may be seeing what I used to refer to as the soda bottle explosion at the end of the day, when I would pick up my son from school or at the end of the day, and I would get the unleashing of the day's problems from him, and it's not a pretty sight. So you may also have a situation where the teachers are seeing things that you're not, and you have to remember that it's a different environment. Your child is in a school setting, maybe with 20, 25, 30 other children in the classroom, which is a very different setting from your home. So when you're talking about some of the distractibilities and things like that can be causing some of the situations, it's a different environment, and they may be having a different reaction. Discussing options for addressing your concerns while you're remaining patient through the school's process. Always want to encourage parents to be an advocate. And what that means is really opening up the lines of communication, staying positive, and recognizing that school districts and administrators have processes in place, and different ways to kind of see who is really having issues as far as educationally or socially, and the process is to be able to evaluate children in the educational setting. It's really important to remember that the educational setting is what schools are looking at. How are these situations affecting your child educationally?
Okay, so medical treatment options. That's one of the things I love about Mandy and I, our collaboration and our practice, is that we bring a blend of educational background with educators as well as therapists who have more of the medical and rehabilitation training. And you'll hear, with parents who are on this ADHD journey, oftentimes it is a blend of having a medical professional diagnose and provide interventions for your child, as well as the need for educational supports. So making an appointment with your child's pediatrician is almost always the best starting point to discuss your concerns. Your pediatrician may offer recommendations to follow up with specialists. And some of those specialists may include a referral for therapy, which could include speech therapy, occupational therapy, behavioral or mental health therapy. There's also family-centered coaching and interventions. More recently, PCIT has been an intervention that is oftentimes recommended to children, typically ages 2 to 7. And that's parent-child interaction therapy. Therapists have to be trained specifically with that intervention strategy. Normally it's a social worker or a mental health counselor. There's family counseling options because, let's face it, ADHD journey does not just affect the child, it affects the entire family. And oftentimes, as the word journey represents, people are in different places with that journey. And maybe some of you, even on this call today, maybe you suspect that your child has ADHD, but you don't know anything about the diagnostic process. And this is all new information. Or you have a child that has been diagnosed, or you've been diagnosed even maybe yourself, and wanting to educate yourself more about, what some of those interventions may be. So the family counseling, parent support and advocacy organizations like PIC, and being able to reach out for community resources is really important. Oftentimes, I will say, as a parent myself, with a child with ADHD as well, oftentimes, you learn about yourself in the process, and you learn that, there are these kind of interesting, learning differences that I had as well, and our awareness around that starts to grow. And ultimately what happens is it lends itself to an environment of acceptance in your home, which is really important for children, and really important, again, when we talk about reducing anxiety and trying to combat some of that negative self-esteem that often results.
I will say, if I could add to that, I read an article recently, and I don't remember the exact percentages, but one of the highest growing number of diagnosed ADHD diagnosis is in women, and it was for ages like 40 to 60, and it's from the fact that we have we're learning through our children. They are going through the process of being evaluated and going in their journey, and through that, ADHD is something that's genetic. So that's a lot of self-awareness of that comes full circle, and there's a population that is very much underdiagnosed and heading to the doctors as their own children are being diagnosed as well. So interesting information.
So the medications, this is something I don't feel qualified to speak at length to this as an occupational therapist, but definitely this is something that we are at times as therapists fielding basic questions for families, and then helping them navigate back to the specialists that can help them with many of these issues. But there are stimulants and non-stimulant medications. Just really important to note that the specialist that you work with helps you understand the side effects, and that you seek the guidance of a medical provider with specialized training. So who are those people? Who medically, a child psychiatrist, a pediatric neurologist, and then a pediatrician. Oftentimes, especially in Southern Delaware, sometimes we're limited by our access to certain specialists. So our local pediatricians will try to fill this gap. It's just really important, especially if you are part of a larger pediatric practice, that maybe asking some questions about who might be well-versed in the diagnostics, in the medications,
has more training
and expertise in that area. Because let's face it, our primary care physicians cannot be experts in the whole gamut across every practice. So really important that you kind of make sure that you're with a provider that can really guide you in that process.
I do want to add too, through the medication journey, if that's something that you and your family decide to do with your child, it's really important to have the mindset that medications are something that there's a lot of different ones out there now. When our age group, when we were growing up, there weren't many. And so there's a lot of different medications out there. And that it's something that can change for your child. Just like as they grow, as hormones change, there's different, types of medications and titrations that will happen. So I encourage you not to get frustrated with that journey if there are changes made or changes, in medication, things like that, because that is, I think, typically part of that process, and to keep that in mind too. Okay, collaborating with educators. I touched on this a little bit previously. Again, keeping it positive, opening up those lines of communication with your child's teachers, and also the administrators as well. It's interesting because when you start to think about having you're feeling like there's something going on there. One of the things is kind of not to know where to go with this, as far as with the schools. So like I said, you're starting it out with opening up with a written communication with the teachers. From there, as far as if you're feeling like, you would like to have some type of evaluation done for your children, typically it is either an assistant principal or the care coordinator, not the care coordinator, the special education coordinator at your child's school that can get those that ball rolling. So, getting together and talking about your concerns and seeing what their thoughts are, and requesting to have those evaluations done is really important. And then once, if there is a diagnosis, and remember that the comorbidity part, so there might be some other things that end up showing up between some learning disabilities, things like that. The eligibility for 504 plan or the individualized education plan, also known as the IEP, would be next steps. It's important to comment that, an IEP is really a change to the actual curriculum for your child, and putting in some sure. Yeah. Oh, sorry. So, putting in some accommodations for your child as well. And that is something that the teachers, need to provide if that is something that they are end up needing. And 504 plans are basically a plan to put in place for different accommodations to help, which we often find with children with ADHD, depending on their symptoms and what types of things that they need. Oh, I'm sorry, here we are. The modifications and accommodations based on that medical diagnosis, and how those different things can be implemented into the classroom to let your child have the ability to be able to be educated and not have their disability be something that impacts their education. Yes. So yes, I love this here. Just take a breath. This journey is, for you and your child, and it is something that, ADHD does not go away. It's not something we can, it's not something like a cold that goes away. So just keep that in mind. But people, children, adults can be very successful with the right accommodations and the different tools that to help through the daily processes that can be difficult. So keep it in mind when we're opening up ourselves to the journey.
Okay, so some strategies for home and school. So this, as a therapist, this is something I feel very comfortable speaking to, and I encourage you, if medications is where your questions lie, to take those back to some of the take those concerns and questions back to your pediatrician. So appropriate movement breaks. At school, it's key that they're not disruptive to peers in the classroom setting. So, you know, that can get a little bit tricky. We have to get kind of creative with how to offer kids who do need that movement throughout the day, how we provide them with those options. So sometimes the option to stand at their desk to do some work instead of remaining seated. I love using busy bands, as they're lovingly referred to. It's a therapy band that goes on the front two legs of a chair, the base of a chair. Those are really great options for both school and for home. If you've got a child who is really struggling to stay seated at dinner time, you know, that is a really good option. They can push and pull their feet against that. And what's really great about that at school is that it's not disruptive to the peers.
And
really,
at home to their little brother or little sister too.
Really kind of out of sight, out of mind. And if they don't need it, they're not using it, then they don't need it. But it's there as a resource. Alternative seating options. A lot of our local schools have really provided some great resources for young children in the elementary schools to have this. Actually, right now, I'm actually sitting on a wobble stool. I work from a wobble stool and found that that was necessary when we got into the lockdown period, and I was doing a lot of telehealth. I'm a therapist. I'm used to moving and grooving and being on the go. And so for myself, I really struggled with being seated for so long. So a wobble chair that gives a little bit of motion is a great option in the classroom, and again at home, or maybe for some of the adults at work. Having the conversation with the teacher about a classroom job to deliver something between classrooms or return supplies within the classroom environment, just so that there's an appropriate way for them to get up out of their seat. And actually, again, speaking to that self-esteem part, feeling positive, feeling some positive reinforcement that they get to be a helper. I put in here, not all fidgets are friends. So a lot of times as occupational therapists, people think that we are just about every single fidget, and that's just like the greatest thing in the world. Not the case. There are appropriate ways to use fidgets and appropriate kids that, kids that need different types of fidgets, some that can use them appropriately, some that they become projectiles in the classroom or at home, and they become problematic. So they're not all created equal. Love the idea of some of the puffy stickers or Velcro kind of tacked underneath a desk surface, where if they do feel like they need to touch something and they're having a hard time keeping their fingers still during more of a lecture or instruction with the teacher where they're not as physically engaged in their learning, that is a great option to put a little piece of Velcro that they can kind of touch and kind of fidget with under their desk. Really important that teachers don't remove recess as a consequence for these kiddos. So this is, again, where some of those meetings might really be helpful to discuss an alternative consequence. It's not that the child shouldn't have a consequence, but it needs to be something that doesn't make it even more difficult for them to function during their school day if they lose that opportunity to move. Do anticipate that your child may need extra support and strategies when they're transitioning from recess back into the classroom or at home, from active play to dinner time or active play to homework, things like that. These kids take, again, when we talk about that emotional regulation piece, that ability to sustain their attention, the movement is helpful, but that transition from active play to more quieter seat work, more sedentary activities can often be challenging, and they need a little bit more support with that. So consistency in daily routines, both home and school. You'll see an example of a visual schedule here that it can be really helpful. So even if your child is a reader, they're a talker, they don't necessarily need some of the visual supports that you might think, are only used for children, maybe with autism or that are nonverbal. Try to keep in mind that because these kids have a lot of difficulty with organization and doing multi-step activities, that they get over prompted. over prompted. So we're doing so much prompting for these kids, and they get frustrated with so much verbal prompting. So sometimes these visual schedules kind of let them have a little bit more ownership in their routine and something to reference to get through their daily activities. So keep that in mind as a resource. And again, for older kids, it can be that that you help them write out a list, or just they can actually write out their own list, and they have a Post-it note in different places, but kind of helping them have a little bit of control with that.
Small dry erase board works great for the older kids too. You're asking them to clean their room. Well, that to them means who knows?
Daunting.
Right.
Daunting.
So here's specific tasks to do. Bring your dirty laundry down, put your clean clothes away, different things like that, where they can break it down, but there's not the over prompting and getting frustrated with that as well. They can take the things off the list.
Visual timers are really helpful too. A lot of children with ADHD have something called time blindness, which means they have a really hard time understanding the passage of time and how much time is required for different activities. So those visual timers can be really helpful. Hands-on learning activities that incorporate those kinesthetic strategies or movement activities. Love sidewalk chalk. Love, love, love sidewalk chalk. You can use it with older kids. You can write words, practice spelling. They can be jumping between numbers and working on addition and subtraction skills, all kinds of things when these kids need to move, especially like Mandy said, if they've been holding it together all day long at school and they're coming home and they're a bit more explosive after being so structured during the day.
Mm-hmm.
Puppet shows with kids where they can do the teaching. Again, let them feel a bit empowered to share the knowledge that they have. They may not have those skills in reading and writing and math, but oftentimes they can verbally express what they know. Mm-hmm. Again, because they have those average and oftentimes above average IQs.
Correct.
So in terms of accommodations at school, extended time on tests and assignments is oftentimes very helpful. And that can be documented as part of an educational plan. These water bottles, these Camelback water bottles, love this brand, not actually for myself so much, but for a lot of these kids that need more oral input. A lot of older kids can do well chewing gum or having like a piece of hard candy, but young children, that's more of a concern. So having a water bottle like this that's non-spill, but you almost have to kind of bite the straw a little bit to get that fluid up. And that is really helpful for some of these kids who need a little bit more input throughout the day. Accommodations for lengthy note-taking, especially if auditory processing, visual processing, or motor coordination, or any of those combinations are a concern, they need accommodations in place at school for note-taking, especially as they get past the 4th grade grade and higher. Assistance with organizational strategies, things like they have a red composition book and a folder for math and things that really kind of help them because that processing just oftentimes takes a little bit more support. Share reading roles between caregiver and child. So maybe the type of situation where you sit next to your child, they read the left side of the page, you read the right, or you take turns between paragraphs. Reading to a stuffed animal or the family pet. Again, ways to kind of make the task feel more engaging and not so overwhelming for children that are struggling with some of those academic skills.
And attention too. Mm-hmm. I mean, that really kind of makes it fun and engaging and not so much of a tedious skill.
The reading rulers, they're almost like a little bit of a transparent like an index card, but they're clear and they typically have a blue or green hue to them. Those can be a little bit easier on the eyes and help with visual tracking. So again, for kids who have a tendency to have difficulty with sustained attention and get distracted easily, it's very difficult to go back to the book and figure out where exactly you were. Those reading rulers can help. And then just connection before correction. So trying to give very specific feedback and encourage flexibility. A lot of these kids get stuck. So they can go from being very inattentive to really hyper-focusing on certain things and have a really hard time demonstrating that flexibility. So giving them very specific feedback instead of something just as general as good job. You did great with that. What did they do a great job with? I liked how you tried to use your Legos to help with your math work. That's very specific instead of just great work. That's really helpful. This time tracker here pictured is one of my favorite tools. This is a visual timer as well. And so it actually lights up. Green means that they have that time to work with. Yellow is more like it's time to wrap up, and then red when the timer goes off. Again, for kids that really struggle to know how much time they have left with something, that can be really helpful. And then lastly, just put down here, this is one of my absolute favorite things to talk about with families, with kids with a variety of different learning needs, but laying on our tummies. Tummy time is not just for infants. So we call it prone, that position when we're on our tummy. It actually gives more sensory input that actually helps kids with calming and focusing. The other thing about this position is that actually, when we're on our tummies this way and we're doing an activity, it actually reduces some of the visual distractions. So instead of being sitting upright or even standing, where we've got our whole visual field and all of these things to attend to, that prone position kind of narrows that visual field and allows them to hone in on what they're doing. So this is really helpful for reading. With the use of a clipboard or a lap pad, kids can write and draw and color in this position. It's great for board games. So if you have a child that really struggles with impulse control and waiting and playing even just a simple game of Candyland or whatever is a challenge, this is a great way to engage with your kids in a position that supports their performance.
Yeah.
So
add one more little thing here at the end. One thing that for parents, educators, anybody who's really involved in a child's life, especially when they have an ADHD diagnosis, one thing to really keep in mind is the emotional toll that that having a diagnosis like this can have on a child. When you think about the different symptoms that affect a child throughout their day that has ADHD, everything, or not everything, but a lot of things that they're doing are different than typical kiddos in their classroom, the other siblings in the house, other grandchildren, and so sometimes they're hearing a lot of the negative, like, why are you doing it this way? Or just the way that things are being said or directed to them. It's really important to keep in mind that throughout the day, continually hearing that you're doing something differently or wrong, as potentially that can be heard sometimes, can do a lot of damage to a child. So it's one of those things where we need to meet them where they are, and with the tools, strategies, accommodations that help them work best and engage with the people around them. So I really do highly recommend just, having a little bit of a shift in mindset of thinking about your child as what do they bring to, what does their diagnosis, which is not who they are, but what does having ADHD bring to other people in that they're around? Because there's really, I hear this sometimes, and I really do believe this, that ADHD is a gift. It's it's a neurodivergent condition that really brings out creativity in a lot of kiddos and adults, and out of the box thinking. When a child or an adult is in hyper focus, as you might hear, there's a lot of great stuff that comes out of being in hyper focus sometimes, some really just different ideas and things. So if we can shift the way we think about the way the ADHD brain works and find the good stuff and support the struggles and the challenges, it can really shift a child's self-esteem and their self-worth. And I say that as an adult who was not diagnosed until I was 40, and my own child was diagnosed, and that you talk about a journey of the aha moments. And you look back at your own childhood and you say, wow, yes, I really did feel those. I felt shame of not being able to do some of the things that, or a lot of the things that my peers, the people the kiddos that I was around, why my brain was thinking differently. So I encourage you to kind of, if you have a kiddo in your life that has that ADHD brain, to find how it works in a positive way, and you will be enlightened and in a good way. So that's my little thank you for listening to that. But just want to put that out there.
So it is a journey.
It
does take a village.
Mm-hmm.
Thank you for joining us. Thank you for having us, Carrie.
Yes.
And if there's any questions, Mandy and I will stay on for a few minutes.
We'd love to
address any specific questions.
Yeah, I think this was an extremely informative presentation. And just to let our participants know, I will be sending out via email the presentation along with our survey. And if you could take a moment to complete that, that would be extremely helpful. If there is, if there are any questions, we can try to open it up for questions. Also, when I send the email, if there is anybody that would like to respond that way, if it's a question for child inspired, I can forward it over. If it's a question that Pick can help, we can do that as well. But otherwise, thank you very much for joining us. And ladies, thank you very much for your presentation. It was fabulous.
Thank you.
Thank you. Thanks for having us.
Yeah.
Yes.
There
is a question. Okay.
Oh, let's hear it.
Oh, okay. Oh, that's a great question. What other alternative consequences besides removing recess? What age is removing recess appropriate?
Well, I think sadly, recess in our area, recess only is till 5th grade through elementary school. Mm-hmm. And then it's no longer an option for, middle school and high school students, which many students would argue would actually be really helpful in their day.
Right.
And physical education doesn't quite close that gap. Because unfortunately, when we get to middle school and high school, they're on block schedules, or they're done by marking periods, and they're not engaged in that class every day. So that gets tricky for older students who need to move. I think alternate consequences, I think that needs to be very individualized between a conversation with the teacher. Mm-hmm. Need to understand kind of what some of those, what some of the different motivators are for that child in that classroom environment, mm-hmm. and maybe something that's more appropriate than taking away recess. Mm-hmm. There may also be limits on recess. This could be a child that maybe needs more support or supervision at recess because maybe they get too wild and they can't, again, when we talk about that transition from active play to coming back into the classroom, this may be where some of those problems occur. So then the teacher feels like recess is the problem. So I think it's kind of understanding maybe when some of those behavior problems are happening in the classroom. And I would also elicit the help of the school psychologists, yes, because they are very good at kind of analyzing behavior and what the function of the behavior may be. And it's really helpful to understand if your child is having behavior problems in the classroom, what time of day is that typically happening? Mm-hmm. What activity might they be trying to avoid? or get out of, or, there's a lot of different components there. So instead of just your child's having behavior in the classroom and we have to have a consequence for it, when are they having the behavior?
Mm-hmm.
What is it related to? And taking a deeper dive into that is oftentimes what really helps get down to the bottom of the issue.
I will say too, that once you on that individual basis with that child, once you've sort of established something other than recess that they find to be, something that they like, or something that's like a positive, when you're thinking about, using that as a consequence, really having, setting up a situation for them to understand that, okay, so there's, you're not just going to take it away. Okay, so I'm seeing this behavior. You're giving them the opportunity to self-regulate before you're getting to the point where, this is something of just being defiant on something. So it's a shift. It's a shift. So let's, it's hard to talk about like something specific for a child that's individually something that they like, but having that conversation and having something in place, and knowing, if the child is one that does not that struggles with prompting or verbal, you have something in place where when they're kind of going down the road of you needing them to get back in line, you do something, whether, and you talk about it, whether it's a hand on their shoulder, or maybe there's something that you are in the classroom and you do that the child knows what it means. You touch your ear, and then that child knows, okay, we're getting a little out of control right now. But you've also talked about the different strategies that when they see you do this, that they can turn to, whether it's the Velcro under their desk. These are things that are already established. And then when we get to the point where we're just like, not doing it and we need an absolute consequence, we get down to that point. But it's really to try to keep it so that they can learn to self-regulate. But they also can't do that on their own, right? They need assistance with that. They need a plan. So keeping that in place. And I understand for teachers, it's difficult when you have, 20, 25 kids in your class, but it's important for these kiddos to feel like they have someone in their court that understands them and can figure out ways to work with them too.
Absolutely. And we have one other question.
Mm-hmm.
How are ADHD and sensory processing linked?
Mm-hmm. So there's often misconceptions about sensory processing. A lot of parents will feel like, well, if their child has sensory needs, then it's linked with autism or it's linked with ADHD, which is not necessarily the case. But they often, again, those comorbid conditions that we talked about, they're very common. And so it is very common to see ADHD and sensory processing disorder linked together. And I think what's most important for families to know is that a lot of the sensory strategies, if they are tailored to the specific needs of your child, they even without sensory processing disorder, some of those sensory strategies help with self-regulation. They help with calming. They help with transitions. So some of those strategies being in place for a child with ADHD, regardless of whether or not they're actual true sensory processing differences, can be very helpful.
I think it's important too to remember that ADHD, a physician or whomever is diagnosing, is really going by that DSM-5 as far as what the symptoms are. And when children are very young, what they're comparing to is not necessarily happening for those children. It has to be for 6 of the 9
Symptoms.
Thank you. Symptoms that you're looking for. It needs to be within a 6 month, over a 6 month period. It needs to be in 2 different settings. So if you have a 3-year-old or a 4-year-old who's they're probably not going to be being diagnosed with ADHD, but sensory processing is something that is what the medical professionals and therapists will be looking at those age groups. So it's important to keep that in mind too. I know for my youngest son, what started out at 3 years old was a sensory processing disorder, and treatment was for that disorder. And like Christina says, many of the therapies and different things that we were doing are self-regulating, right, for different for the different senses. But as he got older and we got into school, and we're in a different setting now, and it's going on, different things are happening in that different setting, all of a sudden it's like, well, there's more happening here. So for our journey, that's how that kind of progressed too. So to kind of keep that in mind as well, that age of diagnosis for different things can be affected.
Yeah.
We have one last question, and then I think we'll end our webinar. So the last question is how is ADHD and diet linked?
So I do not consider
That's a good one.
That's a very good question. Very good question. I do not consider myself an expert in this area. So I will say that as a disclaimer. I will say that I think with a lot of neurodevelopmental conditions in general, we are seeing a lot of children that do have kind of gut GI sensitivities and issues that are at play. And so, I from my perspective, the way I think about it is if a child is uncomfortable, if they have food sensitivities, if their belly hurts, things like that are going on, it's if you're uncomfortable, it's hard to focus. It's hard to pay attention. As an adult, we know this. We've experienced, injuries and different things where it's hard to focus and pay attention if you're uncomfortable.
And we have the words to know that. Yes.
Yeah.
Kids don't sometimes.
Yes. So I do, there is a lot of information out there about, gluten, casein-free diets, sugar,
red
dyes, different things like that. I would definitely encourage you to go back to your pediatrician and then get linked with a specialist. So a neurodevelopmental pediatrician is a great resource to reach out to if your child does have a history of reflux or food sensitivities, things like that. Having a pediatric GI specialist involved in their care is very helpful. And again, we're talking about, we're back to that big, not scary word, comorbid conditions, where there's oftentimes something else, maybe possibly medically, that is going on with your child. And it's important that that's ruled out. And not necessarily that this is just a behavior issue with children, or inattention, when there could be something underlying that's different and needs to be medically addressed.
Right. I think another big one too is the debate over caffeine with kiddos and adults with ADHD. And again, that's something that you'll want to talk with your doctors and get linked with the right specialist with these questions, which is through your doctors. But that's one thing that is definitely out there, that because caffeine is a stimulant, and some of the medications that are sometimes prescribed for ADHD are stimulants. You will often hear that people with ADHD after a cup of coffee in the morning actually are able to focus more. And I'm putting that out there as that is not, I'm not a medical, just hearsay. So, but these are things to look into.
And the other thing, just before we completely wrap up, with regard to food intake, I don't think this is exactly where this question was going to necessarily, but I do feel like with regard to food and diet, it is really important to be having those conversations with your child's pediatrician and specialist, because some of the medication, the side effects sometimes suppress appetite.
Yes.
And so food intake and your child eating enough and eating a healthy diet and gaining weight and growing, those are all things that need to be taken into consideration as well.
Yes.
So
On that journey.
Yeah.
thank you very much for having us.
Thank you so
Thank you
much.
again. Really, really extremely informative. I think this was a fabulous presentation, and I'm so happy that you both said yes to working with PIC. The slides will be emailed out along with the survey. And thank you everybody for joining, and enjoy the rest of your afternoon.
Awesome.
Thank
Carrie.
you. Bye.